Thank you, Mr. Chairman. Good afternoon, Madam Secretary.
Good afternoon.
Last year, there were approximately 650 senior community centers throughout Pennsylvania. Now there are about 550. You're aware of that, the decrease, the closing of so many of the senior centers, with 20% roughly of our population being elderly. Do you have a plan in terms of trying to reconstitute any of those senior centers? How do we keep the 550 that currently exist in existence, and how do we try to restore the 100 that have fallen by the wayside in the last year, because in large part because of lack of funding?
Sure. I appreciate that question and am sensitive to it. As an area agency on aging director for 2 local AAAs in the Northeast during my career, I have seen firsthand the value and benefit of senior centers. They are indeed safe harbors for many older adults in our local communities who, but for that service, may not have a decent meal that day or may not have the camaraderie of their peers. In our work in the Pennsylvania Department of Aging, and with the unfortunate consolidation or closing, whatever the right verbiage may be for that particular community, it does behoove us to certainly utilize the resources entrusted to our care well and wisely. It also dictates that we work with local AAAs to help them as they develop their own planning, their service plans within their community for how funds are going to be spent. And when, unfortunately, challenging or difficult situations need to be made at the local level, such as the hardship that comes with ever recommending to a set of county commissioners or to a county manager the closure of a senior center, that it's done because of facts, because of perhaps the opportunity to visit a senior center within their planning and service area that's close by, and that, again, we're looking at the dollars that make sense, not just for dollars and cents. To go back and to determine if a senior center that perhaps closed in the course of the past couple of years could be reopened, I would commit that I would work with any AAA director that sees that as an opportunity within their planning and service area to work with them to make that potential reality a possibility.
Thank you. In looking over, excuse my voice, please. In looking over the Human Services proposed budget, there's reductions of $25 million dipping into the lottery fund to cover part of the increase in long-term care services that are proposed, and also a reduction, again, a dipping into the lottery fund of $57 million to help pay for home and community-based services expansion. Both of those programs, long-term care and home and community-based services, provide services for, I think, our entire population, our entire adult population. The lottery itself, by virtue of its formation, the statutes that formed it back in the 70s, said that the lottery exists for the benefit of our elderly population in Pennsylvania. If we keep reaching into the lottery fund and pulling it out for, in this case, long-term care or home and community-based services, how can you assure that the money that comes out of the lottery actually funds services that are directed to people who are 65 and older, and doesn't just get commingled in with other funding, and have the services provided for the entire adult population who need it?
Thank you. That is an awesome question as well. As an individual whose father worked for 51 years as a pharmacist in a local pharmacy back in Scranton, the PACE program became very near and dear to my heart. And I know your question wasn't specific to PACE, but I'm confident we will get to that later. But my dad also supported the lottery because it supported PACE, and bought a lottery ticket every day until he breathed his last breath. And with that, my mom continues to do her part, not only to support now what is my job, obviously, but the lottery fund, which is what you just indicated, Representative. And that particular question, as an area agency on aging director, and now that I have the blessed opportunity to serve in this acting capacity, is something that's very near and dear to my heart. The lottery fund was created, indeed, to do exactly what you just indicated, to provide services and benefits to older Pennsylvanians. And with an ever-growing, aging population, it's incumbent upon us to do what we can in order to preserve the lottery fund. I know some questions were just asked of my colleagues in the Department of Revenue with regard to the preservation of the lottery fund. But there is a hopeful desire and a trend and a commitment of this particular budget as we move forward to continue the decrease of lottery funds going to support the gaps within the Department of Human Services budget. In my collaboration with Acting Secretary Dallas, we have talked about that need, and the only way that we feel that we can do that is by continuing our commitment to work collaboratively and to ensure that we are communicating effectively so that we indeed rebalance our long-term care system. I am confident that if we drill down into the details of the dollars that have left the lottery fund and have helped to support other services, that they have indeed provided support to older Pennsylvanians. For the three main buckets of the DHS, Department of Human Services, capacity to receive lottery funds, it does support the aging waiver program, which serves individuals over the age of 60, does support the nursing home programs, which does provide care to individuals over the age of 60, and medical assistance transportation, which again is helping to support seniors in their transportation needs. But I do agree that our commitment is to continue to decrease the trend of dollars leaving the lottery fund to support those efforts.
Okay, thank you. I asked the prior panel the same question I'm going to ask you. 2 years ago, LBFC told us that our lottery fund was healthy, and as long as we didn't change anything about it, it would be healthy for the foreseeable future. Now we have an administration who says that 2 years out, maybe 3, we're going to face deficits in the lottery fund. Do you agree with those predictions? And if so, why? And if not, why not?
Mm-hmm. I certainly agree with the predictions because they were shared with me by pretty experienced and reputable people with regard to the lottery fund. And I appreciated also the answer of my colleagues on the panel just before me, that while the preservation of the lottery fund is up to those experts to do that, it's our responsibility to work together, not just across human service departments, but also with the legislatures with regard to ensuring that we utilize the dollars that are generated by the revenue to indeed continue to support older Pennsylvanians. I can only do what I can do to encourage folks to buy lottery tickets in terms of preserving that fund. But again, it behooves us to work together and to ensure that we continue the commitment to preserve it.
You might feel good to know that I just bought some lottery tickets yesterday. But what do you think what's driving this change from the LBFC saying we're healthy to the administration saying in 2 or 3 years we're going to be looking at a deficit?
Sure. As I honestly sit here 7 weeks in, I think that question is probably best answered by those who put out that particular report.
Okay. Thank you.
Thank you,
Mr. Chairman.